Well, going back to what this guy was, but pretty much that's the premise of what he was saying. He was saying the reason for he's developed a technology based on this because it's such a subjective field. This
trying to make it more objective.
I guess so, yes. And he's developed this technology called Optogenetics. Pretty much they've discovered there's this like light sensitive algae. So pretty much when you shine light on this algae, it's like a fluorescent algae, it pretty much opens up these pores so pretty much when you shine light on this algae, it moves. When you shine light on this algae, it opens up a pore which lets out like sodium and potassium ions and it kind of moves. So he likens that to what's happening in the nervous system, because the language of the nervous system is electricity. When neurons are firing messages to other neurons, it's pretty much sending sodium potassium ions across like a membrane, across a synapse towards other neurons. It's like pretty much like electrical impulses going through your brain. So what they're actually doing is infiltrating this light sensitive algae, fluorescent algae, into people's brains via like a benign virus, and putting in certain regions of the brain. This is a very basic example. Benign means like a non-threatening, like a malignant is like a benign cancer, like a tumor, something like that. So like just a virus that's non-threatening, pretty much. That's the way they infiltrate it. This is a very basic explanation of this very complex concept, by the way. It's a lot more going on, obviously. Pretty much they put it in to say someone undergoing anxiety, the fear center of the brain is like the amygdala, so generally activity there would be a bit more heightened. So pretty much what he's doing is he's putting this light sensitive algae in there, and then when people are sort of undergoing complex human emotions like anxiety or things, they can see what neural areas are actually being fired because this light sensitive algae will trigger, and they can actually incite or inhibit activities. To say someone is undergoing anxiety, they're able to shine this light onto, say, an area of the amygdala to either excite the activity or inhibit activity of what's happening there. So in real time,
so you can almost manipulate it.
Yeah, it's almost like manipulating reality, which is
that is insane.
Pretty insane.
Because like what you're speaking on is just the subjective reality that someone's experiencing, and someone's controlling
what's actually happening. Or they can, He says this is just a beginning. He doesn't want this to be the treatment intervention. He wants it to be a bit more pharmacological, that's less invasive. But he's saying this is just it uses a diagnostic treatment, but can also be treatment-wise. But it's just a more objective way to see what's actually happening in the brain during all these complex human emotions. Because right now we just have words rather than